Okay, so last video, disposition. How do we send the patient out of the emergency department? For anybody who noticed, I have included Noel Boyce's telephone number, which was previously missing. So little Jimmy Jones has appendicitis and we want to get him admitted. You can go to his disposition from here, you can go from this link here, or you can click the button, which is what I more typically do over here in the disposition column. This will take you directly there. You can still push it up here even when it's been entered. That will still take you to the disposition area, even though it doesn't look like a button anymore. All right, and so we're going to say he is going to be admitted inpatient. You have to choose whether it's inpatient or observation. Make your best guess. We actually have some utilization resource folks who are in the department sometimes, and they will help you try to figure out what is the true and proper. Be open to the guidance as much as possible, but it really isn't critical. So just make your very best guess. If it's unruptured appendicitis, it's probably actually going to be observation. Otherwise, if it's ruptured, it may be inpatient. We'll say it's acute ruptured appendicitis and dehydration, and we'll put him inpatient. I'm going to leave these blank right now. Typically somebody else will be helping you with this. This is left over from something else, so we'll enter the disposition. That'll pop us back to the main screen. If you wanted to go to other places, there are links all across the bottom there. So little Jimmy Jones, inpatient. You can see that here it says discharge, and then the destination is detox, so it will have a two-part information here. This one just has one part of information here that indicates to you as a person who's waiting for someone else to complete this page that it has not yet been done. If we go back in there by clicking, if the vitals are abnormal or if they're not documented, they will be flagged on this page or presented to you on this page. Let's say that he is in fair condition and we want him to go to the OR. Again, somebody else will typically be doing this for you. And enter the disposition. So you can see that that is now two pieces of information. When you're ready for the patient to go, you want to signal the nurse, so you come over to the comment section. And for admitted patients, it's very important that you use this orange flag, ready to admit. This has a different appearance because there are more options in the active website. All the admission diagnoses are admit ready, admit pending, admit planned. So they all sort over here alphabetically together. But this one, you're just going to click ready for admit. And this particular flag is moderately important. You can see there are discharge flags also because it comes up here and it tells the nurse that the patient can go. You're done. You've talked to the consultant. You're finished with the patient. We no longer write admission orders, so this is the nurse's only cue that the patient is ready to go. For discharge, on the other hand, let's go to Baby Smith over here. She's vomiting. We're ready to send her home. These follow-up consults, you can generally, you would either choose the schema QA nurse or you would choose the residency clinic. Typically we would say non-urgent unless it was very critical that they get in very quickly, because they get them in within, you know, several days, so they do a pretty good job if they do not have a primary provider and you wanted to establish. If they have a primary provider and you just want to make sure that they follow up, you contact or you print whatever you want in here. This is a free text box, and you put that in there as a note that makes it clear to this person who will find a report in the morning requesting follow-up on baby girl Smith. What is it exactly that you wanted us to do? Same thing for the adult residency clinic. If you had an adult with new onset diabetes that was not severe enough to require admission, then you would put in here that you know, new onset DM needs provider, and that way they understand why they're getting this report. Sorry, just a little disturbance in the recording studio here. Okay, so let's say this little girl, we're going to discharge her. We want her to have a schema QA follow-up. You type your appropriate text in here, and then she's going to be discharged home. And again, these you could fill in, but typically somebody else should be doing that for you. The residents, you may need to fill those in yourself. As the nurses typically take care of the LWOBs. The registration status definitely isn't your problem. All right, so let's say she has a UTI, vomiting resolved, and dehydration resolved. You can put all those things in. You could either hit enter dispo, which will pop you right back out to the main screen, or you can go to final diagnosis, but you don't need to right now. Discharge instructions. You can go straight across the bottom if you want. We don't actually do reconciliation, so you come over here and you say you want to add a urinary tract infection, pediatric. These things are left from before. So let's go urinary tract infection, pediatric. You double click on it or you hit the add button. That goes over here. If you want to see what it says, you hit the preview button. Obviously, you have to highlight that first. I just bumped it out. How odd. Okay. Urinary tract infection, pediatric. You highlight it by clicking only once, and you can preview so you can see what you're actually sending home with them if you have any questions or if you're trying to find something that best fits them. Some of them can be edited and some can't. You can see this is a vendor instruction, so it cannot be edited. That just prints out as it is. If you had some desperate need to think that it was just about perfect, but there was some very important thing that you wanted to change, you can copy this as much or as little as you want. Drop it down into the free text area here and edit it. Typically you wouldn't have to do that, but if you wanted to, you could. There are also some things like the work note that are editable. You can highlight that, you preview it, it will pull up, and then you can actually, you can mark things or you can wholesale delete. You can change whatever you want to say, and then you save the edit for this patient. On the Mac, this box doesn't close after you do that, but it will, and that is the asterisk indicates that it's been edited. And we don't typically do pharmacy instructions. If you have some special thing that you like to say over and over, you can put that in there, and then you just say store. And then later, when you want to load, you can choose from your special things and then click them, and they go right in. These are common instructions that are also translated into Spanish, so you can put those in and be confident that that Spanish is appropriate. Follow up, you can put their primary provider, Guy Kemling, Family Medicine. You can see that I added that previously. And you can add as many as you want. You can add their orthopedist, which is where Daniel Chuck came in. By clicking over there, you choose what you want here. And again, typically somebody will be helping you with this, especially for the emergency physicians. And then you hit enter if you want. If you just wanted to save it, if you just had some special thing you wanted to put in here that you wanted to make sure got entered the way you wanted it, you could put that in here and just come down and say no need to print. But please save. And we're waiting. We need to go to the prescriptions. This is very much like the medications. You can see there are several alphabetized tabs here. The most used lists always stay shorter. I don't know if it's not I don't know if it's because I don't do enough of my own prescriptions or what, but this most used stays very short, but all of the prescriptions that I've asked to have in my quick list are right here. You can see there's a quick list manager, same thing. You can add things, you can change things, you can subtract things. Long list is how you do a search. And this gives you the whole wide world. You can type in whatever you want. Sometimes it's hard to find things because the exact name you're looking for is not there, but anything you find is fair game. Unlike for the medication orders in the house. You can, for instance, lidocaine patches are these top here, lidocaine adhesive patch. There's really only one choice, although it appears to give you more. And you can type whatever you want in here. If you want to add it to your quick list, here's again that quick list button. And we'll see if it'll let me. Schedule is required. 1. Application. Daily. Dispense 30. That would not be an appropriate prescription for this baby girl with a urinary tract infection. If you later realize that somebody's lost it or you printed it to the wrong printer, you can just reprint. And again, you're given a chance to choose the printer up here. And EMTALA and state hospital return forms are part of the forms up here, F for forms, which somebody, again, will likely help you with or do for you. The only thing we really use out of these forms now, because we no longer do admission orders, would be the EMTALA and detox clearance forms. Hold on one second. Okay. So here are the forms. The EMTALA form is there. Detox clearance forms are mostly pre-printed, and they'll bring them to you, and you just sign them. At the end of the day, you can go to My Charts. You set the date down here, and it pulls everything up. Again, these are all fake patients. You can see that there are numbers here. These are the level to which the charts are documented. It doesn't necessarily mean it's the level that you'll bill out. Our coders take care of that, but if there is no number, you know that something is missing from the chart. If you want to go back and look at the chart, you just click. And you can review, make sure you have a nice doctor's note in and you like what it said. If it needs to be signed, it will be red here. You can click on that. It'll take you to the signature area. Then you enter your signature there. Back to My Charts, and you can go directly to the signature area by clicking there. At the end of the day, you'll want to go to All, Reports, and in the next screen you'll see that I have all my links are active, but that's because I'm an administrator. Most people don't have many active links, but you will have unsigned charts, which you should click. And I won't have any unsigned charts. But typically you want to just make sure you catch dates that include all the days you're looking for. Don't worry about anything else. And then anything that you have unsigned will come just as a simple list of patients, and you can click directly on that patient's name, and it will take you directly to the signature area. You sign it, it boots you straight back here, and that patient disappears from the list. You click the next name, takes you straight to their signature area. If you want to review the documentation, you're welcome to, and just make sure that you do the unsigned charts on a fairly regular basis. And I think that's it. Hang on a second. Yep, that's it. Okay, thanks. Good luck.